The person walks into my clinic, sits down in front of me, and before I even ask anything, they already say, "I know my case must require surgery. My knee is destroyed." Then I ask, "Did a doctor tell you that?" And the answer, most of the time, is no. No one said it. The person reached that conclusion on their own, because the pain has been going on for months, sometimes years, because they feel a pop when they bend their knee, because their neighbor had surgery and said she felt great afterward, because they searched online and what came up was wear and tear, osteoarthritis, degeneration, words that sound like a sentence. And with all of that combined, they built a certainty inside themselves. My knee can't be fixed without surgery. I understand where that thought comes from. Chronic pain is exhausting. It doesn't just wear out the body, it wears out hope. And when we're exhausted, surgery can seem like the only definitive solution, a fresh start, a finish line. But here's what I need to tell you as a physical therapist. Wear and tear in the knee does not mean the knee has lost its function. And in most cases, function can be rebuilt with the right muscle, trained the right way. In this video, I'm going to show you 5 exercises I use in my physical therapy clinic with patients who came to me convinced that surgery was inevitable and who today can climb stairs, walk, and live without depending on that decision. We're going to count down from exercise number 5 to number 1, which is the exercise I consider the most transformative for anyone in this situation. And stay until the end, because I'll reveal the best aerobic exercise you should do, and which ones you should avoid, so you don't hurt your knee even more. But before we begin, I need to ask you an important question. Do you know what's causing your pain? Because knee pain is not a diagnosis, it's a symptom. And it can come from many different places. It could be osteoarthritis, which is the wearing down of the cartilage between the bones. It could be tendinitis, an inflammation of the tendons around the joint. It could be bursitis, patellofemoral pain syndrome, a meniscus injury, or even muscle weakness so significant that the knee simply can't support itself properly anymore. Tell me in the comments, do you already have a diagnosis, or are you still trying to understand where this pain is coming from? That will help me better understand your problem. If you do have one, great. This video will add to what you already know. If you don't, that's okay. But it's worth looking for that answer at some point. I do need to say that there are specific cases where surgery is necessary, but that needs to be evaluated by an orthopedic doctor. Still, those cases are the minority. Now, the most common cause of knee pain after 60, the one I see every day in my clinic, is osteoarthritis. And what most people don't know about osteoarthritis is this. The cartilage wear itself cannot be reversed, but the pain and limitation that come with it in most cases can. Because what largely determines whether a knee with osteoarthritis will hurt or not is how much muscle there is around it. Strong muscles stabilize the joint, distribute pressure, protect what is still healthy, and restore function. Function that many people swore they had lost forever. Function is your knee's ability to do what you need it to do. Climb stairs, get up from a chair, walk in the park, play with a grandchild. A knee can have wear and tear and still have function. And a knee can regain function even after years of pain. Think of it this way. Imagine a road full of potholes. You could patch the potholes. That would be surgery in some cases. But you can also build an alternative route, a smoother one that goes around the problems and gets you to the same destination. That alternative route is muscle. When the muscles around the knee are strong and well coordinated, they take on part of the load that used to fall entirely on the worn cartilage. The pressure becomes more evenly distributed. Inflammation decreases. And the pain, even without the wear disappearing, starts to ease. That is exactly what we're going to build now with these 5 exercises. Stay until the end, because they can change your life. Let's go to number 5. Exercise 5, glute bridge. When you have knee pain, putting weight on it right away can create resistance, compensation, or simply unnecessary pain. So we start with an exercise lying down, where the knee gets to rest and the glutes get to work. And why the glutes? Because the gluteus maximus, the main muscle in your butt, is the knee's bodyguard. It controls the alignment of the hip, thigh, and knee all at the same time. When it's weak, the knee starts to collapse inward, pressure in the joint increases, and pain shows up. Strengthening the glutes is one of the most direct ways to take pressure off the knee without even touching it. Lie on your back on the floor or on a mat, with your knees bent and your feet flat, hip-width apart. Keep your arms alongside your body, palms facing down. Before lifting, take a deep breath. As you breathe out, squeeze your glutes, as if you were holding something between them, and push your hips up, forming a straight line from your knees to your shoulders. At the top, hold for 2 to 3 seconds. Then lower slowly. It's during that controlled lowering phase that the muscle really works. Don't rush this part. Your knees should stay aligned with your feet the entire time. Also be careful not to lift too high. The right height is the one where you can keep your core slightly engaged without feeling pressure in your lower back. When it becomes easy, you can progress by holding longer at the top, reaching 5 or even 8 seconds, or by doing it with one leg only, which makes the challenge much bigger. Do 10 repetitions, rest for 30 seconds, and repeat 2 more times. 3 sets in total. Muscle discomfort in your glutes and in the back of your thigh is expected. It's a sign the muscle is waking up. Sharp pain inside the knee should not happen. Now let's move on to number 4. This one works a muscle that most people completely ignore, but that is responsible for keeping the knee on the right track with every step you take. Exercise 4. Straight leg raise. If the glute is the knee's bodyguard from behind, the quadriceps is the armor in front. It controls your descent when you sit down, absorbs impact when you walk, and keeps your knee stable when the ground isn't perfectly flat. Without a strong quadriceps, the knee is left exposed and starts compensating with structures that were not designed for that job. What makes this exercise special is that it strengthens the quadriceps without bending the knee. That means muscle stimulation without joint pressure. For someone in pain, that's gold. You stay lying on your back. One leg stays with the knee bent and the foot flat on the floor. It serves as an anchor. The other leg stays completely straight. Before lifting, contract the thigh of the straight leg, tighten the muscle as if you wanted to push your knee down toward the floor. Keeping that contraction, lift the leg up to the height of the opposite bent knee, about 12 inches off the floor. Hold for 2 seconds at the top, then lower slowly. The secret is contracting before you lift. Most people simply raise the leg. But when you contract the quadriceps first, you activate the right fibers, the ones that stabilize the kneecap, which is exactly where many people feel pain. That detail completely changes the quality of the exercise. 2 very common mistakes. The first is letting the leg bend as you lift. If the knee bends, the quadriceps stops being the main focus. Keep the leg straight from beginning to end. The second mistake is lifting too high. Height is not the goal here. Control is. If you struggle to keep the leg straight, start with a smaller range of motion and increase it as the muscle gains strength. When the exercise becomes easy, you can add a light ankle weight to progress. 10 repetitions on each leg, 3 sets. Rest 30 seconds between them. Now, let's move on to number 3. This is the exercise I prescribe most often for people who feel that pain on the outside of the knee or who notice their knee wobbling when they walk. Exercise 3. Lateral knee protection, clamshell. And this exercise exists for one very specific reason. There is a muscle in the hip called the gluteus medius that most people have never trained in their lives. The problem is that this muscle is responsible for keeping the knee aligned side to side. When it's weak, the knee starts collapsing inward with every step. And that repeated movement, thousands of times a day, creates constant friction inside the joint. That friction is exactly what causes that persistent pain that doesn't go away, even when you rest. To do the exercise, lie on your side with your hips slightly bent, as if you were sitting in a chair but lying down. Your knees stay bent, one on top of the other, and your feet stay together. Imagine you are a closed clamshell. From there, keeping your feet together, open the top knee toward the ceiling, like a clamshell opening. Lift as far as you can without letting your hip roll backward. Hold for 2 seconds at the top, then close slowly. The secret is not letting your hip roll backward as you open. That's the cheating movement your body makes when the gluteus medius is weak. It asks the lower back muscles for help. If that happens, you'll feel the work leave the hip and move into the lower back. Reduce the range of motion if you need to, but keep the hip still. 2 very common mistakes. The first is opening too far and letting the hip rotate. The second is doing the movement too fast. Speed is the enemy of results here. Every opening should be controlled and intentional. If the exercise feels easy from the beginning, you can place a resistance band just above your knees to increase resistance. It's a simple progression that completely changes the intensity. 10 repetitions on each side, 3 sets. Switch sides between sets. Now let's move on to number 2. And here we get off the floor for the first time. This exercise mimics a movement you do dozens of times a day, but that you're probably doing in a way that hurts more than it helps. Exercise 2. Sit to stand. Getting up from a chair. It seems like the simplest movement in the world. But think about it. How many times a day do you do that? 10, 15, 20 times? Now imagine that every time you stand up, your knee absorbs pressure that could be distributed through the quadriceps, the glutes, and the hips. If those muscles are weak, the knee takes it all on by itself. And it wasn't built for that. This exercise takes that exact everyday movement and turns it into training. You're not doing a gym exercise. You're relearning how to stand up in a way that protects your knee. Sit on the edge of a sturdy chair, with your feet hip-width apart and slightly pulled back underneath your knees. Your arms can be crossed over your chest or extended forward for balance. Before standing up, lean your torso slightly forward. Your nose moves toward your toes. This detail is essential. It activates the glutes and quadriceps before you even leave the chair. From there, push the floor evenly with both feet and stand up until you are fully upright. Then, sit back down slowly, controlling the descent without letting your body drop into the chair. The secret is in the lowering phase. Sitting down slowly is what turns this exercise from simple into powerful. This is what we call an eccentric contraction, when the muscle works while lengthening. This type of contraction is one of the most effective ways to build real strength, the kind you actually use in daily life. 2 very common mistakes. The first is not leaning the torso forward before standing, which makes the knee travel too far over the foot and increases pressure on the joint. The second is sitting down too quickly, dropping your weight onto the chair instead of controlling the descent. The lowering phase should take at least 3 seconds. If it feels too difficult, you can start with a higher chair, place a cushion on the chair so you don't have to lower yourself as much when sitting, or use your hands on the chair for support. As you gain strength, remove the hand support and gradually lower the height of the chair. Do 10 repetitions, 3 sets, with 30 seconds of rest between them. And now we've reached number 1, the exercise I consider the most important one in this video. The one that brings together everything we've worked on so far and gives your knee back something it has lost, real stability in real movement. Exercise 1, wall mini squat. Most of the previous exercises worked isolated muscles, the glutes, the quadriceps, the gluteus medius. Each one had its moment, with the body supported on the floor without having to handle its own body weight. That was intentional. It was the preparation. This exercise is the application. The wall mini squat puts all those muscles to work together at the same time, while your body is standing and supporting its own weight. Climbing stairs, stepping off a curb, getting out of the car, all of that requires exactly what this movement trains. Stand with your back against the wall and your feet hip-width apart, positioned slightly in front of your body, about 12 inches from the wall. From there, slide your back down, bending your knees until you reach about 45 degrees of flexion. You don't need to go down to 90 degrees like in a full squat. Here, less is more. In that position, hold. Keep your body still, as if you were sitting on an invisible chair, while you count the seconds. The secret is keeping your knees aligned with your feet the entire time. They cannot collapse inward. That's a sign the gluteus medius has stopped doing its job. If that happens, come up a little, reset your alignment, and continue. Another important point: your body weight should be distributed across your whole foot, not just on your toes or your heels. Two very common mistakes. The first is going too low, trying to reach 90 degrees, which increases pressure on the kneecap. The second is holding your breath. Many people do this without even realizing it. Breathe normally the entire time you are holding the position. If it's difficult at first, start with just 15 seconds and gradually build up. The ideal progression is to reach 45 seconds with full control before thinking about going lower or holding longer. Once you feel comfortable, you can progress to doing it on one leg. But that's for later. Do 3 sets of 20 to 45 seconds with 1 minute of rest between them. Muscle discomfort in the thigh and glutes is expected and welcome. Sharp pain inside the knee should not happen. If it does, come up, rest, and try again with a smaller range of motion. Now I need to tell you something important. And I say this to all my patients when they leave the clinic with a list of exercises in hand. There's no point in doing everything today and then disappearing for 2 weeks. I know it sounds obvious, but that's exactly what happens. The person watches the video, gets motivated, does all 5 exercises, feels the muscles working, and thinks, tomorrow, I'll do it again. Then fatigue shows up, life gets busy, something comes up, and the exercise keeps getting pushed back. Before they know it, 10 days have passed. Muscle doesn't work that way. It needs regular stimulus to change. And regular, in this case, means 3 times a week, with 1 rest day between each session. Monday, Wednesday, and Friday. Tuesday, Thursday, and Saturday. The day of the week doesn't matter. The spacing between sessions does. That gap exists because it's during rest that the muscle rebuilds itself stronger. Without it, you're training a muscle that is still recovering, and the result will be less than it could be. You don't need a gym, you don't need equipment, you don't even need to leave the house. You just need a small space on the floor, a sturdy chair, and a wall. For the first 2 weeks, the focus is not intensity, it's learning the movement. Each exercise has a technical detail that makes all the difference, and those details only become natural through calm, mindful repetition. If you rush through it just to finish quickly, you'll be wasting your own time. And how will you know it's working? It won't be because the pain disappears overnight. That rarely happens that way. It will show up in small things: getting up from a chair without holding onto the armrest, going downstairs without gripping the handrail tightly, waking up in the morning and feeling that your first few steps are a little easier than they were the week before. These small victories show that your muscles are taking over the work your knee used to handle alone. Consistency matters more than intensity, always. At the beginning of the video, I promised I would reveal the best aerobic exercise for people with knee pain, and now it's time. But before I give you the answer, I need to explain why this question matters. Because many people who are doing everything right, the strengthening exercises, the rest, the consistency, still feel pain. And when I ask what they do besides the exercises, the answer is often walking. Every day. 40 minutes, 1 hour, on asphalt, at the same pace they've always walked. And that's when I need to have a delicate conversation. Walking is great. It's one of the healthiest habits there is for the heart, the mind, and the metabolism. But for a knee with osteoarthritis or significant wear and tear, too much walking, especially on asphalt, especially uphill and downhill, may be feeding the inflammation you're trying to fight. Repeated impact on a joint that still doesn't have enough muscle strength to absorb it is like trying to repair a wall while still banging on it. So what's the alternative? Water aerobics and swimming are, in my clinical opinion, the best starting points for someone at this stage. In the water, your body weighs much less, which means your knee receives only a tiny fraction of the impact it would receive on land. But your muscles still work because water resistance is everywhere. You improve cardiovascular fitness, mobility, and muscle strength at the same time without irritating the joint. The stationary bike is another excellent option, as long as the seat is adjusted to the right height, with the knee almost fully extended at the lowest point of the pedal stroke. When the seat is too low, the knee bends more than necessary and pressure on the kneecap increases. Adjust the seat, keep a light and steady pace, and the bike becomes a powerful ally. Walking doesn't need to disappear from your life, but it may need to be adjusted. Less time, a softer surface, a gentler pace. And ideally, after a few weeks of doing the strengthening exercises from this video, because stronger muscles completely change the way your knee absorbs the impact of each step. The final goal is this: to build enough muscle so that walking becomes enjoyable again, without pain, without fear, without having to think twice before leaving the house. Everything I shared here today is based on clinical evidence and years of practice with real patients. But no video replaces an individualized evaluation. If your pain is very intense, getting worse over time, or comes with significant swelling, locking, or a feeling of instability, the best decision is to see a doctor or physical therapist. Not because exercise doesn't help, but because some situations need a closer look before you start any movement. That said, if you've made it this far, you've already taken the hardest step, which is deciding to do something different from what you were doing before. And that matters a lot. I left 2 options in the pinned comment that can help you continue this journey with more structure. The first is a complete exercise program, organized step by step so you can follow it at home at your own pace. The second is a natural supplement developed specifically for joint health and to help reduce inflammation. To learn more, just check the pinned comment below. Tell me in the comments, where are you watching from and how old are you? I read every comment. And if you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel. There's new content here every week. See you in the next video.